Our second presenter, Karen, if you can get your slides shared there, that would be great.
It said I cannot start screen share. Oh, I see. Okay.
Anthony is helping us behind the scenes.
Yes, thank you, Anthony.
Okay, great, perfect. Okay, good. Okay, so Karen Lockie Wong is the Canadian Association on Gerontology Schlegel University of Waterloo Research Institute for Aging scholarship recipient. So we invite our award recipients to participate in our webinar series, as you might have realized. So Karen is a second-year PhD student at the University of British Columbia in the School of Social Work. Her research interests include aging and culture, racial immigration and language diversity, and the experience of people living with dementia and aging and technology. lots of interesting research interests. She is a long-term volunteer with the Alzheimer's Society of BC as a family support group facilitator and public educator. She was awarded the Inspiring Social Worker of the Year in BC in 2021, and that recognized her advocacy work with people with dementia from diverse cultural and language communities. So Karen is presenting on the critical analysis of literature on service integration and access of immigrants with dementia and their families using critical race theory. Well, thank you very much for joining us. And we're just such a wonderful two presenters, one a very eminent scholar, Dr. Gutman in gerontology in Canada, and then a very emerging scholar in gerontology. So yes, it's a nice combination today. So Karen, feel free to start your seminar.
Thank you, Laurie, for your introduction. And it's really a great honor for me to have the opportunity to present this webinar today. And it's also my very great honor to have the opportunity to present in the same section with Dr. Gutman. So as Laurie introduced, my topic today is the critical analysis of literature on service navigation and access of immigrants with dementia and their families using critical race theory. And I just want to acknowledge that today is the Elder Abuse Awareness Day, which Dr. Gutman has also raised it. And I just want to say that elder abuse happens in different elder communities, including immigrant elder communities. Another thing is that I would like to express my deepest appreciation to the Canadian Association on Gerontology for the Schlegel UW University of Waterloo Research Institute for Aging Scholarship. It was a great encouragement to me to continue to pursue my journey in gerontology. Thank you very much. So for my critical literature review, the first research question is, how is the care and support of immigrants with dementia and their families conceptualized in the literature, and what challenges exist in the current discourse surrounding the access to dementia care and support? To begin with, I would like to give a brief overview on how I use a scoping review informed methodology to guide this literature review. So I used it as scoping review informed methodology, and I used it these keywords, immigrants, dementia, and care and support to guide my search. So first I identified these keywords, and then I used them to search databases. After that, I hand searched the reference list of the selected items to look for additional items. I found 672 items from the initial database searches and hand searches. And I referred to the inclusion and exclusion criteria and performed 2 levels of screening. For the first level of screening, I reviewed the title and abstract. And for the second level of screening, I reviewed each selected item from the first screening level in full text. And later, I narrowed it down to 54 items after 2 levels of screenings. I conducted a thematic analysis. So I would like to give a description of the body of literature I reviewed. There's an evidence that immigrants with dementia and their families are less likely to utilize services. Often, it has been explored at an individual level. For example, why are the immigrants not using services? And some literature has moved towards a slightly broader direction, saying that the services are not culturally appropriate. However, they are using culture in a neutral way. They are not looking at race. Even when they looked at race, they have not translated that into how systemic racism influences. So in the review, I did only 3 studies specifically address racism, and 2 other studies consider race as a reason. So I found a couple of themes from the review. So I found 4 themes on how the care and support of immigrants with dementia and their families are conceptualized in the literature. So first, the issues related to conceptualizing care and support on a narrow health focus. And most studies do not look at how the different services work together. Second, much literature does not look into the important role of the family in bridging formal support. For example, only a few studies report that family acts as a cultural bridge and interpreter between the service provider and the person with dementia. Some studies even suggest that informal care and support are obstacle to formal care and support. For instance, they report that reliance upon family care can hinder the recognition of the need for formal support. Third, study usually suggests the cultures of ethnocultural care and support, but not mainstream care and support. The authors of the literature might not be able to see the Anglo-American white culture beyond mainstream care and support. And finally, most studies on care and support of immigrants with dementia do not include the voices of this population. So among the literature on care and support of immigrants with dementia, most qualitative studies only interviewed family caregivers and service providers or observed immigrants with dementia as subjects. Quantitative studies usually only used data from immigrants with dementia to do secondary data analysis, or did survey with their family caregivers or service providers. Only a very few studies interview immigrants with dementia. The researchers had 2 arguments for not including the voices of this population. First, they could not give consent to research studies. Second, the family members knew damn well that family members could speak on their behalf. And from the literature review, I found 4 challenges in the current discourse surrounding access to dementia care and support for immigrants with dementia and their families. First, most research position the lack of use of formal support service of immigrants with dementia and their families as an individual problem of not seeking help. This body of research seldom explores the lack as a structural problem. Only a small body of research explores how support services are offered in a way that the eligibility is too tight for immigrants with dementia to be eligible, too costly for them to afford, and they do not match their culture and language. Second, studies often report immigrants lack knowledge of a Western-bound notion of dementia and related care and support, and more education is needed. Reason for this suggested in the literature include there's a higher tendency for them to normalize dementia, attribute it to non-medical causes, or use alternative medicine. Services are premised upon one way of understanding dementia is not necessarily congruent with how immigrants understand. For example, in the work by Nance and Moen in 2015, they suggest that in the cultures of many immigrants, dementia is understood more holistically. And much literature suggests that immigrants' culture, belief, and practice may limit the usability of support services. Literature reports that immigrants have a culture of family care. It suggests that immigrants tend to care for themselves and decline services. It suggests that this may be because of the value of filial piety, the moral value for adult children to care for older parents. However, the literature may overemphasize the influence of culture. Immigrants may look after themselves because of a lack of care and support that suits their needs instead of the culture of family care. Structural issues pertaining to a lack of appropriate care may influence service uptake. And the final challenge is some studies raise service providers lack cultural competence to work with immigrants, and more training on cultural competence and cultural matching is needed. And some of these studies interviewed or did surveys with service providers and found service providers did not feel competent to work with immigrants with dementia and their families. Some of these studies interviewed immigrants and their families, and they expressed that they felt service provider lacked cultural competence and thus could not trust them. And these studies are indeed very promising because they show a step towards looking at the system, as the service provider or program is the enactment of the system. However, resolving the challenge is more than knowing someone's culture, but recognizing how racism informs the person experience. There's a lack of attention on race and racism. The service users may have a mistrust of the formal care and support system because of systemic racism. And there's limited literature that has examined how systemic racism has destroyed people's trust in the system. A summary of this first question is that from the review, I learned that I need a theoretical framework considering power, structure, system, especially structural racism, and also the voices of the marginalized, especially immigrants with dementia. So now I'm moving on to my second question, how I would apply critical theories on race to understand this body of literature. So my second review question is, how can critical theories on race offer the study of access to care and support and family care of immigrants with dementia? So to begin with, I explored what tenets of critical theories on race can offer to the study of access to care and support and family care of immigrants with dementia. I also complemented the discussion with the concept of intersectionality, which can fill the gaps of critical theories on race. And now I'm going to speak to this further. So for critical theories on race, they draw attention to the importance of race and racism. They focus on both individual and structural racism, as well as external and internalized racism. Critical race theory is under critical theories on race, and critical race theory refers to the theory raised by critical legal studies scholars in the 1980s, which was developed from the discussion on racial inequalities between Black and white people in the legal system in the United States. Other critical theories on race include post-colonial and decolonial theories. This theory traces the history of colonization and look into how it influenced our understanding of race and the development of racism. Critical theories on race have several tenets that help us with the study of family care of immigrants with dementia. So now I'm going to speak on this further. So the first tenet is white supremacy. So white supremacy are believed to have superior well-will than racialized people. As mentioned in my earlier presentation, study often suggests that immigrants lack knowledge of a Western-bound notion of dementia and related care and support. And from the tenet of white supremacy, we can see that this point seems to suggest an assumption that the Western-bound notion of dementia is the only understanding of dementia. Study also find that racialized immigrant service providers trained and working in the Western healthcare system internalize this understanding. Also, as mentioned, some studies suggest family care as an obstacle to formal care. And these studies find that a service provider considered that immigrant family caregivers interrupt them when they were doing an assessment and seeking consent from the person with dementia. This point seems to suggest that there's an assumption that assessment and consent are individual process and no one other than the formal care provider and the person with dementia should be involved. And from the tenet of white supremacy, we can see that individualization in the Anglo-American Western culture is seen as the golden standard. Another tenet of critical theories on race I look into is othering and essentializing racialized people, which means that racialized people are constructed as others and they are essentialized as homogeneous, static with negative qualities and inferior. And these negative qualities are attributed to their race. As mentioned, studies usually suggested that immigrants' cultural belief and practices, especially culture of family care, may limit the usability of support services. However, from the tenet of othering and essentializing racialized people, this point seems othering and essentializing the immigrants with dementia and their family. And a few literature suggests that preference for family care across different populations. Family care is influenced by the culture of both countries of origin and host and factors other than culture. The influences of the culture of family care on immigrants' experience vary due to context and multiple intersecting social locations. Interpretation of culture of family care vary among immigrants, and culture of family care is not static, but changing. The third tenet of critical theories on race is racism in the system. Racism is invisible and embedded in the system. It raises the concept of colorblindness, which means the system do not recognize racialized people and white people are on an equal playing field. From the tenet of racism in the system, we can see that the formal care and support system does not recognize that because of their race and other social locations closely related to race, racialized immigrants with dementia and families have more challenges navigating the formal care system than their non-immigrant and white immigrant counterparts. And a few literature argues that racialized immigrants are less likely to find a formal care that matches their culture and languages. The formal care system does not acknowledge that some immigrants with dementia need more care time. Racialized immigrants are less able to afford healthcare costs and be subsidized. Racialized immigrants are less likely to be eligible for certain care and support. And the formal care system is more complex to navigate for recent immigrants, and recent immigrants are more likely to be racialized immigrants. The fourth tenet is whiteness as property. Being white would help a white person to access more resource and have more expectation of protection of these resources. And white people only transfer the privilege to racialized people when it collides with their interests. So these are the main argument of whiteness as property raised by critical theories on race scholar Harris. And the tenet of whiteness as property explains why there are limited reforms to increase formal care that matches the cultures and language of immigrants. Such a reform means an increase in public expenditure, which will harm the interests of the wealthy. And in Canada and also in many Western countries, many of these wealthy people are white men and have influence on the government spending. And the last tenet is centering the voice of racialized people. So racism can be at both individual and structural level, and the voices of racialized people can be used to challenge and deconstruct the dominant racist discourse in the system. And some will call counter narratives. Some groups of racialized people are seen as having neither agency nor voice to resist oppression. For example, racialized women. However, indeed, they have agency and voices to resist, but are not listened to. And this tenet of centering the voice of racialized people help us to see beyond racialized immigrants' racism at an individual level to a structural level in the formal care system. And this tenet also helps us question where the voices of racialized immigrants are in the care and support of this population. In addition, this tenet helps us to think about how racialized immigrants, women, family caregivers face oppression from both expectation to care as women, that is sexism, and mainstream essentialization of them as victims of culture of family care, that is racism. They are seen as have no agency or voice in their situations. However, they indeed have the voices and agency to cope with their caregiving situation, but these are not heard. And now I would like to draw on an additional lens in my construction of critical theories on race, which is intersectionality. I think this also echoed to Professor Getman's presentation earlier. An elder has a different social location. Racialized elder also has different social location other than race. So intersectionality, as some of you also mentioned earlier in the chat, refers to how intersection of multiple access of structural privilege and oppressions attached to a person's social locations influence the person's experience. I use critical theories on race as the dominant lens in my literature review because I want to center race. Race is important, but it has been overlooked when looking at the experience of immigrants with dementia in the current literature. However, I also want to recognize the complexity of understanding the experiences. Drawing an intersectionality lens helped remind me that I have to also look at how race intersects with other social locations such as culture, socioeconomic status, gender, ability, age. Intersectionality can contextualize a race in a very complex way. It allows the complexity to become visible. And from this literature review and also trying to understand the literature using critical theories on race lens, it suggested that the importance of critical theories on race informing the study of access to care and support and family care of immigrants with dementia and their family. They highlight the failure to address race and racism in understanding the experiences of immigrants with dementia and their families on access to care and support. Moreover, the importance of an intersectional lens is identified in order to develop a more complex understanding that explores how social locations help to shape this experience in complex way. And we need a research method which help us deconstruct the racism embedded in the system. Moving forward, previous studies on critical theories on race mainly use qualitative interviews to explore the experiential racism of racialized people to understand and challenge structural racism. However, although many interviews were conducted, I noticed that the system have not substantially changed, and this was also echoed by some of the scholars in recent literature. For example, Alderbin. I want to highlight the importance of linking personal experience to broader social structure. To conclude, I'm proposing to draw on methodology that have strains on doing so to continue to explore this body of literature and this topic and this body of scholarship. For example, some of the methodology that has the strength doing so, like institutional ethnography. So this is the references, and I really welcome questions, comments. And again, I'm Karen, PhD student at UBC School of Social Work. And please feel free to share your comments and also questions. Thank you very much.
Okay, thank you so much, Karen, for that. I think there's some nice connections you made with Dr. Gutman's work on an intersectionality lens. There was a quick comment there. Is the review published, the scoping review that you were referring to?
Oh, not yet. Yeah,
oh, okay.
But there's a plan for that. Yeah.
Oh, okay. Okay.
Thanks
So
not
available yet, but someone had asked that.
Mm-hmm.
Okay, we just have a few minutes, but I think I can bring up some things from the chat, Karen. So Emily is identifying that your presentation was wonderful, and it raises how there is white supremacy within dementia research. So a question for you is, within the literature on the sociology of dementia, thinking beyond dementia as disease, do you think there's been adequate engagement with race and racism, especially in terms of access to dementia care?
Thank you. Thank you. This is a very good question. Thank you, Emily. To be honest, I don't think so. And I think there's very limited literature to my understanding about the intersection and engagement of race and racism and dementia care. And to my understanding, the literature trying to explore the intersection of race, racism, and dementia only appears very recently, I would say in the last 5 years. And to be honest, I don't think even there's too much literature using a critical race theory to look into not just a dementia care access, but even like the topic dementia more generally. For example, like the stigma attached to dementia and racism. So I think there's a need to further explore using this lens to see how racism intersect with dementia. And one more thing is that currently I'm working with Professor Deborah O'Connor at UBC School of Social Work, and we are doing studies regarding to the stigma of dementia, the experience of people living with dementia, and some of them come from a racialized community, and they talk about like how the intersection of racism and stigma towards dementia actually influence them and negatively affect them in terms of the access to dementia care and services. So we hope to learn more from them, and it is a very important and interesting topic, which I hope that our the academic community can look further. Mm-hmm. Thank you.
Okay, thank you very much. We're at the end of our hour. We had a lot that we covered in this hour. Thank you so much, Dr. Gutman and Karen Wong, for participating in our webinar, and for all of you for joining us. Karen, there was an additional comment that there I didn't quite get to you. I think I can email it to you, or you can look at the chat yourself and respond there to Sadiq. So sorry we didn't get to your question. Thank you all again so much for joining us, and have a really wonderful day.